Even though the COVID-19 situation in Kenya seems to be improving enough to necessitate the lifting of the cessation of movement and other measures put in place in late March, Kenya is still not out of the woods just yet. Health experts had projected that the third wave in the country would peak in mid-May and now warned that as easily as firm public health interventions change the course of the pandemic in the past 4 weeks, complacency could reverse all the gains made so far. Dorcas Wangira with more.
Kenya's COVID-19 trend in the last week looks promising, with the test positivity rates this week standing at 12.9%, 12.7%, 9.8% and 10%. It stood at 22% on 26th March when President Kenyatta announced a raft of measures, the most severe cessation of movement in the disease-infected zone of 5 counties neighboring Nairobi. The zone accounted for 70% of all new infections in the country. By the end of April, this zone accounted for 24.8% of all new infections.
Issued the Second Public Order Act of 2021 in March of this year, announcing the obtaining containment measures. Our COVID caseload in Nairobi alone was 56,815. This caseload has now gone down to below 15,000 for the month of April, signifying a 74% decrease in infections in Nairobi.
According to Dr. Nelly, a teacher and epidemiologist, the trend is heading in the right direction, but Kenyans need to continue taking precautions to avoid another spike.
After 1 month of lockdown, the COVID case load within the zoned areas has come down by 72%. In other areas of the Republic, the COVID caseload fell by 89% and in Mombasa and 90% in Busia between March and April of 2021.
Likewise, the Ministry of Health and counties need to make resources available for treating the sick. Dr. Ahmed Kalebi, a consultant pathologist, further observes that the improving situation in Kenya is a stark contrast to the unraveling escalating crisis in India, where the new mutated variant is being blamed in addition to recent complacency. A reminder to Kenyans that the situation can quickly change if people drop their guard. Health experts had projected that the third wave would peak in mid-May, with positive cases averaging 2,500 to 3,000 a day. In the month of April, 25,260 cases had been recorded, slightly lower than the cases reported in March, the highest number of cases being 1,851 on the 2nd of April, and the least recorded being 194 on the 26th of April. In the last 24 hours, 735 cases have been recorded, tallying to 160,053. 20 deaths have been recorded, 3 being in the last 2 hours, taking the COVID-19 death toll to 2,744. Dorcas Wangira, Citizen TV, Nairobi.